What if a simple handshake could actually predict your future health? It sounds a little out there, right? Well, today, we're going to uncover the incredibly powerful link between your grip, a condition called sarcopenia, and your overall longevity. And to really get this, let's start with a core idea from longevity expert Dr. Peter Attia. He puts it perfectly. Grip strength isn't just about how strong your hand is. Think of it more like a proxy, a snapshot of your entire body's functional health and strength. And believe me, this isn't just some poetic metaphor. This simple test is fast becoming a key diagnostic tool. Why? Because it's quick, it's totally non-invasive, and it is incredibly revealing about our risk for age-related decline. So let's dig into how we even got to this point. So we're talking about sarcopenia, which is basically the age-related loss of muscle mass and function. And the way we find it, the way we measure it, is going through this total revolution, making it easier than ever to spot. Okay, so what is sarcopenia, really? Well, it's way more than just feeling a little weaker as you get older. As you can see from the definition, it's a real clinical condition. We're talking about the progressive loss of muscle, which then dramatically increases the risk of things like falls and physical disability. It really hits a person's independence and quality of life. But here's the thing. There was a huge hurdle for a long time. For years, the medical community just couldn't agree on one single definition for it. And think about it. If you can't even agree on what something is, how on earth can you diagnose it or treat it effectively? It created a ton of confusion. And that lack of agreement, it created a real puzzle. You had different working groups using different rules, which made it almost impossible to compare research findings. And more importantly, patient care was just all over the place. This slide right here really captures the whole situation perfectly. I mean, as recently as 2010, the entire field was fragmented. There was just no single gold standard for what actually counted as a sarcopenia diagnosis. And this chart shows you the results of that chaos. You can see all these different definitions popping up in research papers by 2018. Now, one of them from the European Working Group on Sarcopenia, or EWGSOP, was definitely the most popular. But having all these competing standards just created a lot of noise and made it really tough to get a clear, consistent picture. So that most popular early definition, the one from the European Working Group, it was a two-step process. A patient had to have proof of both low muscle mass and low muscle function, which, as you can imagine, often meant doing multiple, sometimes pretty complicated tests. But this brings us to a major turning point. In 2018, that same European Working Group, the one that made the most popular definition, decided, okay, time for an update. They saw all the confusion and knew they had to create a simpler, more practical way forward. And right here, this is the game changer. The updated 2018 consensus, which they called EWGSOP2, put muscle strength first. So instead of needing both mass and function right away, low strength became the main thing to look for. It became the key that unlocks the whole diagnostic pathway. Now, the crucial thing to get is that this wasn't just some academic squabble. This change made a huge, real-world difference. By focusing on strength first, something you can measure super quickly with simple tools, it suddenly made screening for sarcopenia practical for basically any doctor's office. So how does this new, much clearer process actually work for a patient? Well, it follows a really logical flow. It starts simple and then only adds more layers of confirmation if they're actually needed. Let's walk through it. The new pathway is this clear three-step flow. It all starts with probable sarcopenia, which you can spot with just a simple strength test. If that comes back positive, then you move on to confirm it by actually measuring muscle mass. And finally, you check physical performance to figure out how severe it is. And here are the actual numbers that get the ball rolling. So low muscle strength gets flagged if a person's grip strength is below these cutoffs, or if it takes them more than 15 seconds to stand up from a chair 5 times. See? Super simple, totally objective tests. All right, so let's bring this all the way back to that handshake we started with. This new focus on strength as the #1 indicator. Well, that's precisely why your grip matters so much more than you probably ever thought. Yeah, your grip strength isn't just about your hands. It's a really powerful proxy that overlaps with another key condition of aging, frailty, which is basically a state of being more vulnerable. A weak grip is like a warning light on your dashboard for both, signaling a higher risk of poor health outcomes down the road. And the impact of this simple shift is just enormous. I mean, look at this list. It gives patients a real number they can track and work on.
It lets us spot risks way earlier, which helps prevent things like falls and infections, saving a ton in healthcare costs. And because it's so quick and easy, it just makes the whole process better for everyone. It's a total win-win.
So at the end of the day, this simple test gives us a powerful, proactive window into our health. The next time you shake someone's hand, just remember the wealth of information that could be hidden in that simple gesture. It really leaves us with a final crucial question to think about. What is your strength telling you about your future?